I am Dr. Mary Walker. I am the only woman who got a contract to work as a surgeon on the battlefield during the Civil War. I'm the only woman in uniform who was captured as a spy, and I was imprisoned in a horrendous Confederate prison. And I am the only woman who has ever been awarded by Congress the Medal of Honor. I want to tell you about my life. I want to tell you what it was like for me as a woman before and during and after the Civil War, and what it was like for other women during that period of time. I was born in 1832 in Oswego, New York. I was the youngest of 3 older sisters, and I did have a younger brother. I was born to wonderful parents, especially my father, who came over from New England, was a poor carpenter, but he did work as a country doctor. My father had very unique ideas, that he really felt that women should be treated equally to men. As a result, myself and my sisters were educated, as well as my brother, and this was very unusual for women during that period of time. My father also had ideas that the way women dressed were very restricted to them, and felt that women should wear very loose type clothing, more similar to how men dressed. And I was very much influenced by his ideas, which I later developed into my own ideas of dress. I went to a private Christian school. Graduated there. I was trained as a teacher, which is really the only occupation women could have at that time, but that really wasn't of interest to me very much. Instead, I went home to my parents. I read my father's medical books, and I said, I am really interested in this. I think I would be a wonderful doctor. There were a few women physicians during that period of time. There were 2 medical schools. There was an allopathic medical school, which was the main medical school that trained surgeons. Only men were admitted to this medical school. There was a second movement of medical schools called the eclectic movement, which did admit a few women. The first female doctor, Dr. Elizabeth Blackwell, went to an eclectic medical school, and I was admitted to one as well, which was called Syracuse Medical College. Elizabeth Blackwell went to Geneseo Medical College, which was very near where I went to medical school. What was unusual for me is that my father supported my medical education. The other early women doctors were frequently totally rejected and abandoned by their families. When I went to medical school, I excelled in it. I was first in my class, and I gave the graduation speech. I met my husband, my future husband, when I was in medical school. But I didn't immediately get married. I went to Cincinnati for 6 months, which was the center of the eclectic medical school movement. My husband wrote me and said he wanted to get married. I moved back to New York, and my husband and I set up practice for 2 years in Rome, New York. At that time, my husband said that he believed that marriage should include other women and not just a wife. This was totally unacceptable to me. I was raised in a very good, ethical, moral Christian home, and it was unacceptable. So I left my husband. I tried to start divorce proceedings. In New York State, for a woman to initiate divorce was almost impossible. It took me 10 years before I could get a divorce. At this time, the Civil War was just beginning. I was always very patriotic. I had a strong sense of duty, a strong sense of trying to help the wounded. So I got on a train. I went to Washington City, and I assumed that I could easily be able to work as a doctor. Washington City at that point was overrun with the wounded from Bull Run. They really weren't set up well to treat all of these wounded in a whole variety of different buildings. The doctors were very overwhelmed, and none of them were willing to have me work as a physician. They said if I wanted to be a nurse, that would be all right, but not a doctor. Eventually, Dr. Green was so exhausted that he agreed to have me help him, and I was able to work to some degree anyway as a physician. The other thing I noticed in Washington City then is that, which was totally disorganized because of all the wounded coming into the city, that a lot of the wives, the mothers, the daughters of the wounded were coming into the city to try to find their wounded, the men in their lives, and to help in their care. Women who were unaccompanied during that period of time were considered prostitutes. As a result, no boarding home, no hotel would accept them. These women were living on park benches. I found that totally unacceptable. In my spare time, I went to politicians to try to get this changed. I didn't really have any success. I eventually found a very wealthy benefactor who was willing to rent a boarding home, and so these women would have a place to live. Eventually, I got other women involved forming the Washington Relief Society, and they joined together with other women's relief associations in major cities on the East Coast, forming the Sanitary Commission, the Women's Christian Society. And during the Civil War, these groups of women raised millions of dollars, which gave additional supplies and support for the men on the battlefield. Now, after Washington City, I felt I really could do great service if I was working on the battlefield. And again, that was something certainly women in any capacity, including women nurses, didn't do it, more or less a woman physician. And I went to several different battles, Warrington, I went to Fredericksburg. I was very much loved and respected by all of the wounded men that I treated, but it was nowhere nearly as well accepted by any of the other male physicians at all. They really didn't think that a woman was capable of being a physician during that time. Now, after working for over a year on the battlefields, I felt, why isn't I being treated like just all the other men physicians? I felt I deserved a salary. I was doing volunteer before. I deserved a salary. I deserved a commission. I wrote to Washington and certainly petitioned to do it, wrote to the War Board. They totally rejected me. They said I was completely unqualified. This was purely because I was a woman. I wrote to President Lincoln about this, and President Lincoln wrote a letter back to me. And he said, basically is, no way am I going to get involved. You can talk to the War Board. I absolutely couldn't believe it with his very outspoken wife that he really would give a response like this to me. So I continued to volunteer until one very brave general who had lost his physician and surgeon agreed to give me a contract, which was a very small salary, even though there was no way that I could get a commission, which means I couldn't get a rank. Now, this was General George Thomas who did hire me, and I went down to Gordon's Mill, Tennessee, which is right on the Georgia border. Because I didn't have a contract, didn't really stop me. I made my own uniform. I dressed in exactly the same way as the males did. I felt that I certainly deserved to have a contract, even though they wouldn't give it to me, and that's how I worked. After the wounded were treated, the women and the children in the countryside in Georgia had gotten no medical treatment. They were really very ill. They needed a doctor. I would go out into the countryside and treating them, even though I was warned that this might be dangerous, but that wouldn't have stopped me. But on one of these trips out, I was captured. The Confederate soldiers said I must be there only to be working as a spy, and they took me to Richmond, Virginia, to one of the horrendous Confederate prisons, which was Castle Thunder, across the street from Libby, which is the better known one, but these were old tobacco warehouses. When I was put into this prison, I had never been in conditions like anything like this before. This was a totally closed-in building. There was no windows whatsoever. There was just rats running through the buildings. I only had a straw mat. Because I was the only female, I did have a single room rather than the men who were crowded in together. There were vermin in the food. It was really inedible. Once a week, I was allowed to go out on a porch and get some air. I requested to treat the Union wounded that were there, and they refused my request. Eventually, after 3 months, and I think because I was in the commandant's office every day complaining about all the conditions that were there, and I think also because I had a lot of notoriety and I was in the newspaper all the time, that they eventually exchanged me actually for a captain, which was really an honor since I didn't have any rank. When I left the prison, I lost half my weight, and I was only weighed about 60 pounds, and I lost half my vision from infection. As a result of that, it was really difficult for me to ever practice medicine again because I wasn't able to see very well. But I still had my contract. And so I went down to Atlanta, and I worked with General Sherman. While they were deciding what they were going to do with me. What they did is they sent me to a female position in Louisville, Kentucky, a prison in Louisville, Kentucky. They made me medical director of this. When I went there, the conditions, again, were deplorable. And all the male guards were freely having relationships with all the women that were in the prison, whether they wanted them or didn't want them. I found this totally unacceptable. I complained about this. I said this has absolutely had to change. As a result, I was fired. It was just not possible for me to change the tradition. And then I went to a small refugee camp after that, and then the war ended. I went to England for a year because of, at that point, England was more acceptable of equality with women and more acceptable of my mode of dress. And as you can maybe see, my mode of dress was very different than the standard one of women, which wore tight corsets, and they wore hoop skirts and skirts that were on the ground, and everything was tight and enclosed in women. And my mode of dress was no corset, even with a uniform or out of uniform, that I always wore pants, and I only wore a skirt to my knee, and never wore any tight-fitting clothes. In this country, my mode of dress was totally unaccepted. In the middle of the war, in my uniform, as I'm dressed right now, I would walk through the streets of New York City. If a policeman saw me, I was arrested. I was called indecent dress, and I was put in jail multiple times overnight just because of my mode of dress. So after the war, I came back to this country, and I needed a source of income. All the men who participated in the war got a pension as a result. I got no pension at all, and neither did any of the other women. A female nursing corps was started for the first time during the Civil War. They also didn't get pension. So I spent my time petitioning again in Washington City and in Congress, and I actually succeeded in getting pensions for the female nurses, but I did not succeed in getting one for myself. It was President Johnson during this period of time, and maybe because of some feelings that I wasn't able to get any pension, I was awarded the Congressional Medal of Honor. Basically, what was said that I got it because with a letter from General Sherman, and he did say that I was reporting on troop movements, even though I've never admitted to doing that, and also because that I was captured as a spy and because of my service there. But even getting the Medal of Honor, which was absolutely wonderful for me, I still needed a source of income. So I thought a government job would be valuable for me, and I thought applying for the Department of Pensions, which I had a lot of feelings about, but of course I was turned down for a job. But that just didn't seem right. During this period of time, the White House was, and now at this point, it was General Grant who had become President Grant. The White House was a completely open building. So I took my mats, I took my cooking tools, and I moved onto the floor of the East Room of the White House. Now, I said, I'm going to stay here until President Grant comes out and he addresses us and he's going to offer me a job. I was actually there for 2 weeks. President Grant eventually came out and he looked at me and said, all right, I will give you the job that you want, but you have to dress like a lady. You have to stop wearing pants and you have to wear a dress like other women, and then you may have your job. Now, of course, I would never change my mode of dress, but because he did offer me a job, I agreed to leave the White House. After that, Mrs. Grant was so upset about my being there for 2 weeks, the White House became a closed building. And they put a fence around it. And I was really responsible for the White House being much more what it's like right now as a result of my behavior. Eventually, again, earning a living was really a very difficult problem. Eventually, I did get a job, actually in the Department of Pensions, very briefly, and for some unexplained reason, because I wanted to make changes, I was fired in a very brief period of time. After that, I spent a lot of my time trying to lecture. I was in Washington a good period of time, trying to make changes. I was attempted to get involved in the suffragette movement, which I certainly thought was important. Other suffragette leaders had no interest in me whatsoever. They said how I dressed detracted their cause. They did not like it that I got a lot of press attention, but I also had a very different idea than they did. And I wrote my own treatise explaining why the Bill of Rights and the Constitution already said we the people and women were people, and we really didn't need an amendment for women to vote. Obviously, they disagreed with me. As a result, they locked me out of their conventions and they wrote me out of their textbooks, and I was never heard of as part of this at all. I wrote several books about women and about equality for women. My most famous book was called HIT. I really addressed three major topics in this. The first one is when men came back from the war, many of them had been drinking heavily. They were addicted to laudanum, which is an opiate, and they came back and were really quite abusive and very violent toward their wives and children. And I found this totally acceptable, and we're trying to help the women deal with this problem with their men. The second issue is during this period of time, only men smoked, women didn't. And I really felt that the heavily smoking was certainly causing problems with breathing in the men. But there was also difficulties with, I felt, with the smoke affecting the women and children, and they were having breathing problems, and I felt that it would shorten their life. Both those ideas that I talked about with the abuse of the women and the smoke affecting on other people were ideas that were rejected. And what I hear is it took many, many years before anyone even considered my ideas that I wrote about. I eventually went back to my home in Oswego and started a school for women. My father had died, and he left the home to me. This was so unusual. It should have been given to the male, my brother. My brother was so angry about it that he never spoke to me again. But in Oswego, and setting up a school and teaching women about equality, I was very loved by all the other people who lived in Oswego. When in 1917, they changed the rules about getting Congress about getting the Medal of Honor. They felt that it should only be awarded to meritorious service on the battlefield. As a result, my Medal of Honor, I was taken off the roll of getting the Medal of Honor. I never gave back the medal. I kept it with me up until my death, but I was taken off the rolls. I died in 1919, right before actually the Amendment for Women's Right to Vote was passed. I actually died because I was in Washington and again trying to put forward my causes, and I fell on the Capitol steps. And after my fall, that I really never recovered from it, and I died fairly rapidly after that. In 1977, I hear, long after my death, my grandniece petitioned President Carter to get my Medal of Honor reinstated. And he thought it was extremely worthwhile, that I was deserving of it. And it was reinstated, and thus I have become the only woman to the present time that's ever been awarded the Congressional Medal of Honor.
I am Major Jonathan Letterman, Chief Surgeon of the Army of the Potomac, the father of battlefield medicine, and the father of emergency medicine. I have this distinction because of the work I did during the War of the Rebellion in completely reorganizing medical services for greater quality and efficiency. I went to Jefferson Medical College, which was one of the few medical schools in North America that provided clinical training in a manner similar to what was at the time called the Paris School that was beginning to take shape in Europe. Shortly after I graduated medical school, I joined the Army, and I was deployed in the Seminole Wars in Florida. Subsequently, I was deployed in Minnesota, New Mexico, and some other places in the West. This experience in the forts in the West was very helpful for me in my subsequent work during the war. Shortly after the War of the Rebellion broke out, I was called back east. I served for a period of time in the Department of Western Virginia, and in 1862, I was appointed by Surgeon General Hammond, with the approval of General McClellan, to become Chief Surgeon of the Army of the Potomac, with the task of reorganizing the medical services to address issues of quality and efficiency. And truly, that was a major requirement at the time. The situation at that time in the medical department was nothing short of catastrophic. Every regiment had its own regimental surgeon, whose experience in the field was frequently doubtful at best. If your regiment was involved in battle, this regimental surgeon was swamped. If not, he had very little to do. There was no organized system for evacuating wounded from the field. So if you were wounded on the field, you had to make your way to the regimental surgeon. If you couldn't do it, your buddy, your friend, could drag you. Sometimes musicians were tasked with doing this, with little experience or training in doing so. As a result, after a battle, men would frequently remain on the field unattended, occasionally for days. And this is only one of numerous issues that had to be addressed. In addition, little medical attention was provided until you got to the regimental surgeon. And bleeding was a very big problem with battlefield wounds, and sometimes people would bleed to death before they even got medical attention, which could have saved their lives. So there was a great need for some urgent attention close to the site of the battle. There was also a need to provide a rapid response in the medical facilities. So if a wound, for example, involving a penetrating wound with foreign matter, for example, frequently resulted in blood poisoning. Blood poisoning would begin within 2 days. It could be addressed prior to that, but once the first symptoms occurred, it was already 100% fatal and it was already too late. So whatever had to be done soon. Accordingly, I reorganized the medical department to address this and numerous other issues. We created a professional ambulance corps responsible to the medical department. Prior to this, the ambulances were responsible to the quartermaster, who used them not just for medical supplies, but for general supplies very frequently, and sometimes they were not even available to the medical department when they were needed. And they did not include stretcher bearers. So we created a professional ambulance service, including stretcher bearers, to evacuate wounded from the field. We created field dressing stations near the site of the battle for providing immediate attention. So, for example, someone with a wound to the limb that was bleeding profusely could get a tourniquet, something that was often not done, and could get the wound dressed before they were sent to the field hospital. They also selected a population that required immediate attention for rapid engagement in medical services. We also created a system of field hospitals in the rear, on high ground, near a source of water, and preferably close to rail transportation if possible, so that men could be transferred to the military facilities in the east. We also reorganized the operation of the department, of the field, within the field hospitals, to allow for better quality and very rapid processing of wounded men, which I will describe a little bit later. This operating system was first initiated in Antietam, where we processed 10,000 wounded in 24 hours, which was previously thought to be impossible. As a result, the mortality from battlefield injuries dropped by 2/3. We continued to improve on this system and other aspects of medical care until a system that was perfected, in our opinion at the time, and fully implemented for the first time here in Gettysburg, where the field hospitals were concentrated after the first few days of battle into a single organized field hospital in Gettysburg, in the rear, on high ground, and this was referred to subsequently as Camp Letterman. Camp Letterman existed from the time of the battle in July for 6 months until November, during which time the medical service processed 20,000 casualties, both Union and Confederate, and did such a good job that the system was adopted by all Union armies very, very shortly thereafter. In addition, there were European observers present, reported these results back to Europe, where it was implemented in European armies, where it was referred to as the American system. This dramatically improved urgent care in general, not just for the military, but it was eventually adopted for civilian use also. Another major issue that we had to address was disease. Now, as bad as the situation is with processing battlefield casualties, actually 2/3 of all deaths were due to disease, not to battlefield injuries. And here the situation was likewise terrible. Men who had frequently not traveled more than 20 miles from home in their lives, were placed in camps, very concentrated with other men, in unsanitary conditions, and diseases were rampant. And we're talking about everything from measles to typhoid, yellow fever, and dysentery of various kinds. Scurvy was likewise very common, and actually, even though it was common to see scurvy lesions, 2/3 of those with scurvy are too fatigued to be useful as soldiers, even if they don't have cutaneous skin lesions. And all these had to be addressed, and all these had to be addressed urgently. Well, and I will just take them one at a time, although we address them concurrently. First issue is scurvy. We knew from the British experience that fresh fruits and vegetables were scorbunic, would prevent scurvy. However, this is very hard to provide to an army in the field. It presented numerous difficulties. So the problem was presumably solved with what's called desiccated vegetables. This is vegetables that have been boiled, sliced thin, dehydrated, and canned. Now, I knew from my experience in the West that these were not scorbunic. They did not prevent scurvy. And I knew that the solution was actual fruits and vegetables. So I convinced General McClellan to arrange, as difficult as this may be, to provide fruits and vegetables to the men as part of their diet, which resulted almost in the elimination of scurvy. In addition, we addressed some of the sanitation issues that were, we believe, responsible for the prevalence of disease, particularly dysenteries of various kinds. So disease is contagious, and its contagion is caused by something called miasma. Miasma, we believe, comes from rotting flesh. And when it gets vaporized into the air and sometimes causes a smell or vapors, it enables infection to spread. So we address this by ventilating the rooms better, spreading them out so that there's more distance between individuals, moving the latrines some distance from camp. This resulted in a dramatic reduction in sick call. Prior to this, sick call was sometimes as much as 25% of the Army. Afterwards, it was less than 10% and usually not as big an issue. So these are two of the very major problems that we addressed. We did a great deal that saved a great many lives. Of the numerous things we did, the one thing that saved more lives than anything else, without a doubt, was amputation. Now, as I indicated, a penetrating wound has a very high likelihood of causing blood poisoning, and this will begin within 2 days. And it's untreatable, and it's 100% fatal once it starts. So the only thing we can do is, if we see risk for blood poisoning, is in a penetrating wound to the chest or abdomen, there's really nothing much we can do. But if it's a wound to the limb, we can amputate it, and we can amputate it above the level of the wound and prevent blood poisoning and death. So what we did is we reorganized the system to be able to do these quickly and efficiently and also effectively and with experienced surgeons. So, for example, someone would come in from the field dressing station on our ambulance with a tourniquet. You had 1 or 2 minutes at best to examine the wound and determine whether amputation is necessary. If so, you proceed immediately to amputation. So first thing you do is anesthesia. You might have heard otherwise, but we did in fact use anesthesia. Chloroform or ether, we much preferred chloroform to ether. So we would put them under a level of anesthesia sufficient to enable no memory and no pain. Then we would cut through the skin, cut a skin flap on either side and move them, and then we would cut through to the bone. We would tie off bleeders with silk sutures, imported from Europe. And incidentally, the Confederates did not have this because of the blockade, and later I'll tell you what the Confederates used. After this, we would then cut with a bone saw through to the bone. And this experience by so many men is why surgeons began to be called sawbones. We would then tie off any other bleeders that we see, cauterize if necessary, remove the tourniquet and check again, close the, suture the wound closed, suture the skin flaps closed, move on. I'm wearing a white apron. I will wipe my instruments clean on the apron, and I will move on to the next patient immediately. And after a major battle, we would do this about every 15 minutes for about a day and a half, almost nonstop, bathroom breaks only, no sleep. This resulted in 60,000 amputations during the course of the war, of whom 45,000 survived. Very few would have survived without amputation. We effectively saved 45,000 lives. And the 25% mortality, almost all due to infection, was better than the British experience in the Crimean War 10 years earlier. So there's nothing that we did that saved lives as much as amputation. Nonetheless, it was a very traumatic experience for those who had amputations and for the families back home. It resulted in a tremendous amount of difficulty. 45,000 men returning home, having undergone amputation, resulted in an enormous amount of criticism, pretty much all of it unjustified, with few exceptions. There were newspaper articles and letters, so much so that we had the situation reviewed by a British-trained surgical specialist. And he wrote that although occasionally he believes amputations were done unnecessarily, there is no doubt that far more men were lost for lack of amputation than for amputation, and that the medical service was doing a good job. I put the process so that if there was any doubt about the decision for an amputation, 2 experienced surgeons were to examine the patient, and if they agreed that an amputation would be necessary, it would be done by another surgeon also with experience. This diminished the criticism somewhat, but it did persist throughout the rest of the war. These men were moved to military hospitals in the big cities where they underwent rehabilitation and, in most cases, prostheses. And I would add that this volume resulted in a tremendous amount of improvement in the science of rehabilitation and the medical science of prostheses. We also had several other major issues to tackle, but one of the things I think it's important to mention is the fact that the transition of medical science itself. Surgeon General Hammond ordered the establishment of what he called a medical museum. The museum meaning basically something for education of physicians about medical progress, not in the sense that some people might consider the term. Okay. Medical officers were told to report experiences back to the medical museum, where it was published and distributed to medical officers throughout the country. They were also instructed to perform autopsies to determine causes of death, learn from them, and likewise report these to the medical museum. In addition, medical officers were frequently offered and issued microscopes to examine tissue specimens from diseased tissues. At this time, I would point out that there were no more than a handful of microscopes in all of North America. So this is something that was quite remarkable and quite new. They also received instructions on how to use them. And they proceeded to report to the medical museum samples, including photographs of samples that were to be published and distributed. We learned an awful lot from this. the clinical trials were started. And that is, we looked at different approaches to medical conditions. For example, they looked at hospital gangrene, different treatments for it. Nitric acid was found to be too caustic. Bromides were found to be effective in that they resulted in little damage and improvement in tissue infections. The results were tabulated, submitted to the Medical Museum, and published. This is the first real example of the publication of a clinical trial, at least in North America, aside from the Paris School. In addition, medical officers became subject to training and examination. So in order to become a medical officer, since the physicians who came into the service as regimental surgeons had frequently very little training and hardly any experience with the type of casualties that were being seen, and frequently no experience whatsoever in the type of surgery that had to be done. So we established a training program, followed by examination, both written and oral, which you had to pass in order to become a medical officer. Those that could not pass such an examination became contract physicians who worked under the supervision of the medical officers. This process likewise changed American medical education forever. So we now have a scientific approach to medicine, and we have medical education. 3,800 medical officers returning after the war was over transformed American medicine from classical to scientific, and likewise transformed medical education. The experiences during the War of the Rebellion were published in 1870, including contributions by yours truly, in a 5-volume set. And this served as a guide for medicine, for surgery, and for medical education for years to come. So the contributions that we made were not just to the men and the service, which were very as important as they were, but likewise to medical science itself.